All right. Hello, class and Dr. Irwin. My name is Allison Love, and myself, alongside my classmates here, we did a community assessment on Booneville, Kentucky. So I'll get the ball rolling here. To start, we just did a little background and identification of our community. So Booneville is located in Owsley County, Kentucky, and it was established in March of 1847. And it was actually named after the frontiersman Daniel Boone. And looking at it in a more recent light, as of the last census in the year 2020, the population of this town was only 168. Gonna keep moving this back and forth so you guys can read here. So for our project and our community, we decided to focus on a prevalent health issue of cancer. And more specifically, we focused on colon cancer and lung cancer, and we'll get more into that as we go through the slides here. But looking at Booneville, the mortality rate is 36% higher in Booneville than in the rest of the nation. And Kentucky as a whole actually has the highest death rate from cancer of all the states. And the rate there you can see is 177.3 per 100,000 people, whereas the national average is 144.1 per 100,000 people. So again, as I mentioned, lung cancer and colon cancer are most prevalent. And this is due to the kind of environment of the county. There's a lot of coal mining and tobacco fields in this area. And there's a lot of carcinogens that are found in the waterways and soil. And these include asbestos, radon, chromium, and arsenic. And additionally, and we'll get more into this as we go into the next slide, there's a lack of screening in this community. Anyone that wants to travel for any health screening has to travel outside of the county to get screened. So for our project, we wanted to ensure the accessibility of preventative services to help prevent cancer in this community, and that was the purpose of our project. So we had a couple different methods that we were going to use to make sure that this was able to be done in Booneville. And we'll get more into that as we go into the proceed model. But I just wanted to mention the things that we are going to do. We are going to ensure that our community is able to get transportation to find access for any preventative screenings. So this could be a rideshare app or some form of public transportation that could be available for these citizens to get from their community to the nearest healthcare facility. Additionally, we wanted to provide them services at home that they could use. So we thought of things like at-home fecal testing, such as the Cologuard. I'm sure many of you have seen the advertisement for that on television, or some form of technological advancement, such as a text to their phone or an app that could help them get reminded to not smoke or provide them with alternatives to smoking. So looking a little bit more at Booneville, why this is an issue there. It's a very small community, as we mentioned, and the total area is actually only 1.5 square miles. As I briefly mentioned, it's very rural, very segregated, and the closest hospital is over 30 minutes away. I know this picture is hard to see, but it's actually specifically 36 minutes by car to get to the nearest healthcare facility. It's a very low income area. The median household income is only $50,000. There's a lack of education. 20% of the population here never graduated high school, and it's not a very diverse population either. There's 94% of the people living there are white. Lastly, it's important to mention the life expectancy is lower than the national average. In Booneville, for men, it is 66.4 years, where it's normally 76.7 years. And for women, it's 74.4 years, where it's normally 81.5 years. And as we go into, our target population for our project, we are focusing on all of these adults in the community. So any man or woman, anyone over the age of 18 that could be considered an adult. Continuing, we talked about local resources and stakeholders, and we kind of said that our resources and stakeholders were one and the same. So we found a couple that already exist in the community. There's the Owsley County Medical and Dental Clinic, which currently offers Black lung treatments and evaluation for the citizens that live there. And then there's the Owsley County Health Department, which offers cervical and breast cancer screenings. What we noticed, though, is that neither site offers any screening for colon cancer. So that was something that we wanted to really focus on as well. So looking at those hospitals that were involved, as I showed on that map a couple slides ago, the Kentucky River Medical Center is the closest hospital. So we thought we could get their involvement as well in our project. I'm going to turn it over to my colleagues here.
All right. Sorry, guys, this didn't show up on the bottom. Okay, so when searching, hold on one second. Okay, so for primary and secondary prevention strategies, as we know, primary prevention strategies are used to intervene before a disease occurs. These can include vaccinations and altering risky behaviors. Secondary prevention identifies diseases in the earliest stages through regular screenings. And when looking at Booneville's most prevalent health issues of lung cancer and colorectal cancer, both the CDC and United States Preventative Task Force recommend screening individuals between the ages of 50 and 80 who have a history of smoking with low-dose computed tomography, and that's a LDCT. For colorectal cancer, the screening age is relatively similar, and that's between 50 and 75. There's a variety of tests available depending on a patient's history and preference, but a colonoscopy every 10 years remains the gold standard. Some primary prevention strategies described by Healthy People 2030 apply to both lung and colorectal cancer and involve increasing health literacy, which allows patients to make informed decisions regarding screening and effective management practices. And this in turn, so an increased health literacy decreases preventable diseases. Next slide, please. And when searching the literature for evidence-based interventions to decrease Booneville's prevalence of cancer, we found that access to primary care and effective screening reduced mortality and morbidity of lung cancer and colorectal cancer. And as stated on the previous slide, and as Allison talked about, there's many different screening strategies that exist. Two of these strategies in particular I found would be nice options for residents of Booneville, depending on their medical history and preferences. One was the fecal immunochemical testing, FIT, which costs less than a colonoscopy and does not require travel. FIT has been shown to increase compliance with 69%, with a 69% screening rate compared to 38% patient compliance with colonoscopies. And the other one was digital therapeutics, which included providing text messages as an adjunct to health advice, which increased rates of abstinence in smokers by 10.7%. And these are both nice and they're helpful because some of the barriers to accessing colorectal and lung cancer screenings in rural areas include the lack of transportation, lack of screening awareness, and fear of diagnosis. But while these strategies increase screening, they're still not a substitute for the gold standard test of the low-dose CT and colonoscopy. And ride-sharing models can bridge the gap and allow residents to improve access to necessary diagnostic tests when recommended. Van pools such as Jaunt have been proven effective in rural Virginia, and they allow 5 to 15 passengers to carpool to doctor's appointments and diagnostic appointments. Federal, state, and local funds are used to supplement fares that are received from riders. And some of the things that are needed with these, there's going to need to be coordination and maintenance of vehicles. And that concludes my part.
Hi, this is Sarah Grubbs. I'm going to discuss the first portion of the pre-seed proceed model, which, as we know, is kind of a framework that we can use to help start a behavior change in individuals and help combat a issue. In this case, it's the prevalent cancers, lung and colorectal cancer, and the lack of accessibility. So step one of this model is social assessment, and we've already went over a lot of this information, but it's kind of looking at the community. There's 168 residents in Booneville, 94% white and 20% never graduated. I also wanted to point out that the poverty rate was 8.74%, and there's few local job opportunities. And then, as we've discussed, the life expectancy is lower than the national average. We also discussed that the closest small hospital is 35 minutes away, and the closest regional medical center is an hour away. So after we looked at the community, we go to step 2, which is epidemiological diagnosis. We identified our prevalent health concern, which is cancer, and some of the factors, which are coal mining, smoking, and exposure to carcinogens like radon and asbestos. And then we made our own kind of goal, and we stated by the year 2030, the number of deaths from cancer in Owsley County will reduce by 10%. So that's the goal that we set for our target population. Step 3 is the behavioral and environmental assessment. There was a lot of information here, but I just kind of condensed it down. We have the need for a decrease in the rate of smoking. We need to increase education and motivation for the citizens of Booneville for the importance of cancer screenings. And one of the biggest issues that there's no colon cancer screening available in Booneville, and we need transportation for residents to receive the screening. Next slide. Step 4 was educational and ecological assessment. There was a lot of information here. The Crosby and Knorr article helps us identify some of the different methods by which we can encourage change. There's predisposing, reinforcing, and enabling factors. I'm not going to read through everything, but I wanted to point out a couple important ones that we identified, such as advertising and collaborating with the state health department, local health centers, and clinics to provide free or reduced cost cancer screenings for persons earning less than $30,000 a year. That's an example of an enabling factor. Also, we wanted to incorporate the use of a health promotion model, the HPM. This is a basis for a campaign to explore the relationships between prior behavior, interpersonal influences, education, socioeconomic status, environment, and benefits barriers to action related to seeking preventative cancer screenings. So we want to look at the individual, their reasonings for not choosing to get screened. Is it a lack of education, lack of motivation? Look at the demographics of the area, the socioeconomic status, and then help them to make a positive behavior change. And then step 5, we had administrative and policy assessment. And our goal is to assess Booneville's abilities and resources to lobby government bodies, provide radon test kits, nicotine alternatives, and free or reduced cancer screenings, and then providing transportation to the testing facilities.
Hey, so Abraham here. So continuing on with step 6, some of the points that need to be considered in the implement phase of the model are health promoting strategies according to the objective of the project. For instance, like what are the strategies and how are they aligned with the objective? Moreover, the time frame and required resources for the strategy's implementation may also need to be considered. The implementation phase may include consideration of the participation of all stakeholders and the development of an intervention and strategy to implement the intervention. Now with step 7, in the phase of process evaluation, the study of process indicators and the resources and procedures for the verification of relevant indicators take place. The project objectives that were established during the assessment phase, as well as reporting on the intervention programs and relevant strategies, are some of the aspects that could be considered in the process evaluation. So for example, this phase would be where you could evaluate on a regular basis, meeting with the local resources, as we talked about earlier, distribution of radon kits, training, and the transportation provided to people for their testing. Next slide. In step 8, the phase of impact evaluation, the study of impact indicators and the resources and procedures for the verification of relevant indicators take place. Just like the process evaluation, some of the aspects that could be considered in this phase are the objectives of the project that have been established during the assessment phase and reporting the intervention programs to relevant strategies. So things to look at regularly here could be something like the percentage of people who can get access to preventative care. In step 9, the phase of outcome evaluation, the study of outcome indicators and the resources and procedures for the verification and relevant indicators take place. This can be done with the help of the study of morbidity and mortality related data. So things to look for here would be the trend of the rate of smoking, data related to transportation and services provided to the people of Booneville for screening. Next slide. So in conclusion, the issue of smoking and cancer can be attributed to the lower level of life expectancy in Booneville, Kentucky, and the use of the precede-proceed model is beneficial in implementing and in evaluating the health-related steps. Some of the different challenges that could be experienced throughout this process could be the lack of time that could be provided by government bodies, the lack of confidence of the stakeholders in the project, and the lack of compliance of stakeholders with the agreed upon strategy. These barriers are, could be overcome by increasing people's awareness and just engaging them in the project. And next slide would just be our references. And that's it.